Social stories are an intervention strategy developed by Carol Gray. The purpose of social stories is to help individuals with autism spectrum disorder, or ASD, gain knowledge of social understanding and decrease the challenging behaviors commonly associated with impairments in social understanding. Difficulties identifying, interpreting, and using social information is one of the universal characteristics of autism spectrum disorder. Social stories are individualized, simply written, and often paired with photographs or illustrations. They typically revolve around descriptions or scenarios of a desired skill, behavior, or social situation that is relevant to the individual and efforts to show them how they should appropriately use that targeted skill, behavior, or social experience. They are composed of 6 different sentence types created by Carol Gray, such as descriptive, perspective, directive, affirmative, control, and cooperative sentences. These various sentence types each serve a different purpose to the intervention. Creation of social stories should include the parents, teachers, and other caregivers, as those people know the individual the best as well as interact with the individual frequently and should know the skills being targeted so they can also encourage the behavior. It is important to note that social stories are designed to change the social understanding, not the social behavior, in hopes that the change in social cognition will generalize to a change in social behavior across multiple contexts. Although there is a lot of research that yield positive results for the effective social stories, the research conducted on social stories is almost all in the form of single case designs. Single case designs are considered lower on the evidence-based practice hierarchy of levels of evidence due to their individualized nature that limits the study from being generalized to a population. A large number of authors of descriptive and quantitative systematic reviews also state there are methodological limitations in the current research of social stories. To quote Hutchins from Chapter 13 of the textbook Treatment of Autism Spectrum Disorders, these include confounding treatment variables and lack of experimental control, weak designs, small treatment effects, and general lack of studies establishing treatment fidelity, reliability of measurement, and maintenance and generalizability of outcomes. End quote. In this sense, social stories do not have the strongest evidence base, and further research needs to be done under conditions of a higher level on the hierarchy of evidence. Many factors of social stories still remain unaddressed or need significantly more research to determine their efficacy, one being the use of social stories to teach academic skills. In a systematic review done by Reinhout and Carter, none of the 16 studies examined included a social story with an educational base. Another factor needing more research to determine the efficacy of social stories is whether this form of intervention is suitable for a person with a severe diagnosis of autism spectrum disorder. More specifically, if it is suitable for an individual of severe cognitive and language impairment. Many studies show the effect on individuals with a mild form of ASD. The amount of studies exploring the impact of social stories on the adult population is also extremely lacking, with almost all studies involving children-aged participants. An additional factor that needs more research is whether social stories are as effective of an intervention when used in isolation. Most studies include confounding treatments like physical or verbal prompting, reinforcers, role-playing, video modeling, and visual schedules, and do not reveal if the behavior change was due to the social story or because of the other methods involved, or both. One study done by Paluzak, where video modeling and social stories were implemented individually and compared, revealed that video modeling was more effective in reducing the inappropriate behavior than social stories. This does not prove that social stories are ineffective, but is one example of how other interventions may be a better option and that social stories may only be useful when combined with other methods. Although social story intervention has shown to induce progress in the social cognition and skills of clients, this progress is not beneficial unless maintained across time or generalized across other settings. One study done by Reinhout and Carter investigated the perceptions of teachers that use social stories. Majority of the teachers stated the implementation of social stories as effective, but did not continue that support when considering maintenance and generalization. This did not come as a surprise, as this is consistent with a vast majority of research and systematic reviews. Maintenance and generalization are either not reported or do not occur in most cases. As learning a new skill seems very positive, if the client is eventually going to lose this skill, or if they will not be able to carry it over to multiple settings, it substantially loses its value. More studies need to be done that focus on maintenance and generalization of skills resulting from the use of social stories and factors that may improve these important aspects of any therapy treatment. Social stories seem to be a promising intervention strategy for individuals with autism spectrum disorder, but the exponential lack of research for many factors, including studies higher on the hierarchy of levels of evidence, cases involving severe ASD diagnosis, especially severe language and cognitive impairment, as well as the adult population, social stories, intervention, and isolation, and the absence of maintenance and generalization of the social understanding developed from social stories prove this therapy technique still has a lot of need for the investigation on its efficacy. The small amount of research that has been done on social stories intervention, not coinciding with other methods, has shown that social stories are not as effective as the other method. Additionally, the few studies reporting the maintenance and generalization of skills developed from social stories treatment reveal small percentages, and more research on factors that can improve these needs to be done. Social stories, in my opinion, do not have enough evidence base to be considered an established intervention technique for individuals with autism spectrum disorder.